Dr. Garth Fisher was board certified by the American Board of Plastic Surgery in 1993, and he is located in Beverly Hills, California, USA. Dr. Fisher's practice is exclusively limited to aesthetic and cosmetic plastic surgery. He was named one of the top plastic surgeons in the United States for facial cosmetic and breast surgery in Best Doctors in America, an authoritative listing of the nation's top physicians in each medical specialty, and he has been on numerous Best Doctors lists. As the first doctor selected for ABC's hit Extreme Makeover series, Dr. Fisher is the plastic surgeon who started the Extreme Makeover phenomenon. He was also listed in the Castle Connolly Directory of America's Top Doctors, an honor bestowed on less than 1% of the country's physicians. For his contributions, Dr. Fisher has been included in Marquis' Who's Who in Medicine and Healthcare and is a lifetime member of Strathmore's Who's Who. Dr. Fisher's expertise has been recognized and honored by the fashion and beauty industries. He has been consulted for many television, news, and magazine interviews and is one of the most recognized doctors in the world. He lectures internationally, is a published medical author, and currently assists other plastic surgeons from around the world in further refining their surgical techniques.
Hi, I'm Dr. Garth Fisher. Over the years, we have had patients come from all over the world for consults regarding plastic or cosmetic surgery. From that first phone call when they asked for information, I felt embarrassed that we didn't have a thorough package of relevant information to send them. Many patients ask their friends, spend hours on the internet, go on consultations with other plastic surgeons, and even read current industry and medical brochures that are available. Patients often remain confused or uninformed. Those sources of information are simply not enough for the patient who wants to be fully informed about the procedure they are considering. Some patients are very interested in changing something about their appearance, but are possibly too embarrassed to arrange a consult, while others may not want to pay travel expenses or consultation fees, which may range up to $500. I wanted to provide one of the first and best sources of information about most plastic surgery procedures on a VHS or DVD format so a patient did not have to search anywhere else. By describing each procedure in detail, the indications, benefits, risks, alternatives, and video footage of real people going through each procedure, I really hope that we've addressed a lot of your questions and concerns. These patients do not read scripts, they tell it like it is, so others may gain knowledge about the procedures and possible experiences. The information is broken down in a very easy to understand way for the average patient. With over 250 photographs of some of my patients before and after surgery, as well as complications, there is simply no current source for so many pictures. Over 100 more graphic illustrations are also provided in an easy to understand way. I wanted to create the most honest, comprehensive, and organized source of information available today for someone considering plastic surgery. I also wanted to help patients learn how to select a plastic surgeon for their procedure and weed out the truth from the sell. I feel this tape easily accomplishes those things and is an absolute must for anyone considering plastic surgery. Although people definitely age at different rates and with different degrees of severity, there are classic signs and anatomical changes associated with aging in everybody. The quality of the skin itself changes due to a variety of factors, including genetic and environmental influences. Repeated animation, facial expressions, trauma, cumulative sun exposure, and byproducts from smoking and pollution contribute to aging changes in the elastic architecture of our skin. Some patients have a history of acne or had previous surgical procedures which have left hard to conceal scars on the face. These factors, among others, can lead to undesirable changes in texture, pigmentation, scarring, and wrinkling, which ultimately detract from the appearance of our skin.
There are basically 4 problems associated with the skin that may be addressed or improved by various procedures. These are wrinkles, texture issues, pigmentation problems, and scarring. The various procedures which might be useful in treating some of these conditions include non-surgical procedures such as Botox and collagen injections, or surgical procedures such as dermabrasion, chemical peels, or laser resurfacing. It is important to know that these various accessory procedures do not take the place of brow lifts, facelifts, or eyelid surgery that remove excess skin and redrape tissues that have descended from the effects of gravity. The accessory procedures discussed here often complement surgical procedures. They are also useful in those patients who do not yet quite need or want a more invasive surgical procedure. Wrinkles are permanent structural changes in the skin made in areas subject to repeated animation and facial expression, chronic sun exposure, and aging in general. Raising your eyebrows repetitively creates horizontal lines in your forehead, while squinting causes vertical and horizontal frown wrinkles between and around the eyes. Repetitive smiling creates permanent wrinkles around the corners of the mouth and outer eyes, as mobile skin is pushed up like an accordion around the eyes to cause what we call crow's feet wrinkles. Wrinkles also form around the lips and mouth from associated repetitive movement. These wrinkles indicate there has been permanent damage to the skin, just as if a cardboard box had been folded repetitively. These changes cannot be completely reversed and will return if the muscle activity that causes them continues.